Hi, I'm Dr. Galip Gurel. I work in Istanbul, Turkey. I have a private practice which is basically covering every kind of treatment, but mostly specialized on aesthetic dentistry. By origin, I'm a prosthodontist, but I certainly believe in huge interdisciplinary teamwork approaches in every case. Well, basically everything is gradually expanding. Digitized dentistry is getting more into our lives now. We use a lot of CAD/CAM systems, whereas we use some digital ways of, again, communicating with the team, communicating with the specialists, and maybe for some applications, thinking of designing things in a different way. So basically, whatever you do, whatever this aesthetic dentistry is going, it's still in your hands. It's still in your feelings that you have to initiate the treatment and then get the help of digital tools, whether it be software or hardware or CAD/CAM technologies, to incorporate into this aesthetic treatment. Well, actually nothing much changed if you're asking just the last year, because there have been projects that we've been working over the last 10 years, I would say. One was to achieve better communication with the team, create some protocols, create some workflow, so that wouldn't matter if the lab is in-house next door or lab is in Brazil somewhere, or in France, or in Switzerland or Germany, that when you follow the same protocols, it's easy to deliver the material to the people that we are working with, and just keep nice file and track of the patients. So this is something that we've been using over the, say, past 10 years. And we just came out with a new concept, which I'll be explaining in the Quintessence meeting in Los Angeles this weekend, is about how to make personalized dental smiles. So the topic of the lecture will be the art and science of personalized smile designs. And this is a very, very new concept with a group years ago that we've been working with. Braulio Paolucci, the Brazilian very talented dentist, came up with this idea. And then people like Marcelo Calamita, Christine Kochman, myself, Eric Van Doren were creating cases depending on this concept called visagism. But we took it to a next level now, and that is to incorporate not only the patient's facial features into the design, but their inner being, their characters, their personality to the smile. And we came out with very interesting results on where to relate the person's character, where to relate the patient's facial features. And when you combine it, automatically things start flowing in a very, very natural way. So this is basically the biggest change in my practice lately, especially the work I'm doing with Adriano Scheider from Brazil, who is one of the most talented ceramists in the world, and Braulio Paolucci, again the dentist from Brazil, who came out, who was the starter of this concept. So that's something that starts with the mock-up, with the wax-up, with the provisionals, and with the final porcelain veneers, or any restoration you make. The results are automatically coming into a very natural-looking outcome. Well, in this question, if you're asking me as Galip Gurel, is that I always do my own mock-ups. I don't start any case by digital means. I can get some help from these kind of procedures, for example, after I'm done with my mock-up. So if you ask me basically how the workflow goes in my hands is that the patient gets a mock-up for the first basic design, and that goes into the lab, comes back with a wax-up. The wax-up goes back into the patient's mouth as the APT, the aesthetic pre-evaluative temporaries, before doing anything, get the acceptance of the patient, find out your functional outcome, and when these matches, then we start prepping the teeth through this, which gives us the best reference point as possible for being minimally invasive, and then we follow it up with the final porcelain veneers. So basically, in my setup, it goes more with my own hands. Well, that actually was not surprising to me because I was witnessing this throughout the years, but to make it more scientifically evidence-based, we made a very broadened research in our practice. So the whole thing goes 12 years back as a retrospective study, and we picked up all the cases we documented A to Z, and we divided the groups into three as tooth preps limited to enamel only, tooth preps with some bigger scale dentin exposure, tooth preps with huge dental exposure. So we had these three categories of tooth preparation, and they're 12 years of post-op status. And we've been very harsh on ourselves. We picked up every small point that can be a failure as a failure. So this is not the survival rate. This is, I mean, the veneers can stay, but the question is how aesthetically stable they can be after those years. So with all this outcome, what was interesting is that when we limit our preps to enamel only, the success rates are going as high as 99%. It's huge. I don't see anything in the dental world with this high success rate. Whereas if you limit or if you exaggerate your preps over dentin, and mostly it's on the root surfaces that the soft tissue receded and you want to extend your veneers into that area, or you had some composites that you want to take out and incorporate, which means not only you're having dental exposure on the tooth surface, but the margins are also either on dentin or on the cementum, then unfortunately the success rates are coming down to 68%, which is huge. Then what I would say, if you choose to work like this, you're seeing 1 veneer out of 3 failing within the next, let's say, 10 years. So to avoid that, this is why I wanted to pass this message that please try to be minimally invasive. And if the tooth position is not in the right place where it should be, please force the patients get into ortho. So the name of the game in dentistry is placing the tooth in its correct position. This holds true for veneers. This holds true for implants. If you don't place the implant to where it should belong, okay, the implant will osteointegrate, but what about the aesthetic outcome? It will never be the same. So get the things into their positions where they should be, and then do whatever you want in terms of minimal invasive dentistry. Well, of course there are differences, and these differences used to be huge. Like in Europe, people would always ask for very natural looking teeth. So if their original teeth were like A3, they would want you to reproduce teeth which are very closer to that color, maybe A2. Whereas it was really on the very white and bright side in the States. Turkey was like a mixture of these two cultures, but Recently, what I'm seeing that, and this was one thing we were discussing with my ceramist, Adriano, amazing. We were discussing about the color outcomes because we were having some problems in some cases. And really, the cases we were doing previously were more successful. And when we went down deep into why this was, because we were producing more and more like A1, A2, A3 type of colors, which are warm colors, which are very easily to be reproduced. But now the basic trend is moving towards more on the white side, also in Turkey. So that is difficult because you can get opaque looking white very easily, but when you want to add some light, some color into that, that is the most challenging part in dentistry now. So more and more people are asking for whiter and brighter colors, but to achieve it in a more natural way, that's the biggest problem. Well, I think if we will be able to create more whiter and brighter teeth in a natural way, I think that will be the most challenging part. I can see some people are using the digital smile concept, some people are using the mock-up concepts, but at least there is now a better awareness that people don't just take the impression of the existing teeth, send it to the lab and asking for miracles for lab to produce. So somehow the dentist is now learning the role of themselves as a pre-starter of the whole project. So this is like either you do a mock-up, you do a DST, you do whatever you want, but you supply the lab with something, like with an impression, with some pictures, with some videos, so that the lab knows at least a little bit of where they want to end up the case with. So this, I think, is something the whole world start working with. Some preparing things in advance to the laboratory. The rest is like, again, as I mentioned, incorporating the inner being, the personal expectations of the patient into the design, so that the end result feels like it's as if it's been belonging to that patient since years. Well, I think working very hard because it's an art form of our profession. And okay, some artists are more talented than the others, but practice brings excellence. At this age of my career, which has been like almost 30-some years, I still see every patient myself, and in every single patient, I do a new mock-up. And this is still now for me a great learning experience. In every case, you can catch up some small details, but when you put it into your bank of thinking and designing, for the other cases, you have a huge thing to think about when you end up or when you face some difficulties. So for them to repeat things, do it, and not get bored of what they're doing, I think is the key, because if you're talented and on top, if you're really practicing like in sports, that amazingly brings the success to you. Wow. Well, I think the best thing I've done over the last couple of years is that I reduced the time of my lectures. It was, for some periods, like crazy. It was like 40 weekends. And honestly, I love lecturing. It's great. But I love working on the field more than this. So when I spend more time in my clinic working one-to-one with the patients, this is the time which I enjoy the most. So when I dropped this, I kind of brought everything into a very nice balance, so that now in the office I have time to work with the patients, and more importantly, I have time to spend with my hobbies. One of my biggest hobbies used to be kite surfing. That's something amazing with the adrenaline coming out of your brains. every time you jump high, 4 or 5 meters, whatever, doing the tumbles. But lately now I have a little bit more time for myself. I started playing golf. I'm back to golf again, which I used to do years ago. And I really enjoy that a lot. So, well, everything I've been trying to share with you has some passion inside. If you're not passionate, you wouldn't be successful in dentistry. You wouldn't be buying these videos. You wouldn't be listening to these conversations, whatever. But then you would be doing it in a way that, as if you're doing it halfway. So what I would recommend, do whatever you do passionately. But passionate is not being the slave of your profession. So do it very hard when you're with the patients, when you're with the things you plan to do with dentistry. But after that, just lock your door and enjoy outside. Enjoy spending time with your family, with your friends. Spend time on nature. Do your hobbies, sports, whatever it is. This is the only way you can train your brain becoming more creative. So balance everything and do whatever you do passionately. Well, I think I love giving responsibilities to the people and don't question it again. So even if I am like the team captain in our office, I've never been bossy. I've never been insisting on the things that I say should be. Of course, I do have some values, I do have some ways to follow, and this is how they grew up. Because everybody in my office, it was their very first jobs. Dentists straight out from the school. Even the secretaries, it was their first job, the assistants. So they just grew up with the mentality I tried to set into this whole package. So for them, this was very normal. Whereas for many other dentists, things seems like crazy in the office because we don't, as I mentioned before, we don't talk. We come eye to eye, and we understand what the things, what is going on in the practice. So another part is they've been very, very talented people, but they have great hearts, so that it brings the whole thing into like a family atmosphere. No jealousies, no egos. Of course, there are some egos, but if you use it in a positive way, it's always upgrading, putting one on each other. So I think that was the success of our office, that we kept everyone that we've been working there at least minimum of 10-15 years, and hoping more to come, because it's very win and win for everyone, for my associates, for the lab, and eventually for the patients.
For more education programs, visit the Guide Institute at www.guidedental.com.